Hi, guys. Welcome to the Metabolic Health Doctors YouTube channel. I'm so happy you have joined me today. And if you like learning about metabolic health, make sure to like, subscribe this channel because I promise to continue to bring in great guests like the guests I have today to the channel. Today, I have Dr. Kesslering, who is a board certified radiation oncologist. She actually works remotely to help people achieve metabolic health as it relates to just general metabolic health and, of course, cancer related health. And I really wanted to bring her to this video because at times we're all, my patients always come to me and say, what test should I do for cancer? And most of us are familiar with getting our colonoscopy or our occult stool test. We're familiar with our PSAs, our mammograms, our pap smears. But are there other things that we can use as a guidepost to help us understand our risk for cancer? So since I have an expert with us today, let's see what she has to say since she deals with this question often. So, Doc, what do you say? What do you do when people come to you and they want to get answers? And I know the science is still evolving, but what kind of things can they look for to get a sense of their, I would say, risk for developing cancer?
Well, that's a really tough question because there is no magic answer. But what we do know is that cancer is typically a metabolic disease. And so I'm always trying to get under the hood and look for metabolism issues. And unfortunately, in our conventional medical world, we often don't diagnose that until someone is at the stage of pre-diabetes or diabetes. But there are other diseases that go along with that metabolic health picture. So we know that diabetics have a higher risk of cancer, but plenty of people without diabetes also get cancer. So what is that? So I love looking under the hood and looking upstream. So what is somebody's fasting insulin resistance scores like HOMA-IR, which looks at glucose and insulin relationship. I look at IGF-1 or insulin-like growth factor 1, which is a sister hormone to insulin. We know that those two hormones are typically higher in those patients who get cancer. And the higher it is, the more advanced disease maybe somebody will get. I will also look at other things that also kind of are surrogates for insulin resistance, like triglyceride HDL ratio or triglyceride glucose index, just different calculations using different tools to kind of get a similar picture. But interestingly, there's one that's not talked about too often, but lactate dehydrogenase or LDH is an enzyme that is used when we are used a lot when we're doing anaerobic exercise. So we're fermenting glucose, turning glucose into lactic acid. But when our metabolism is a little bit broken, we tend to have broken or damaged mitochondria. And damaged mitochondria is kind of a hallmark of cancer, that cancer cells often have significantly abnormal or damaged or absent mitochondria. And when that happens, our cells actually start to upregulate lactate dehydrogenase. So when that goes up, we know that there's also a potential significant problem. So those are kind of my main tools, but there are many. My tagline on my company is actually data-driven health. I really like to look at a really large panel of labs to get the most robust feel for what is actually going on under somebody's hood.
Well, I appreciate that. There is a lot to learn, and the science is evolving, and that's why we're having this conversation because so many people are really afraid of the second leading cause of death, which is cancer, which I totally understand. Thankfully, there are ways to improve your metabolic health so you can at least do your part to reduce your risk for cancer. I have good news, and that's that the doctor you're seeing in front of you and others have, put together some education for you. It's called Metabolic Nutrition for Cancer course. And we're going to share a link in the notes to this video so you can look into that. And it's so important if you have friends or family or you're yourself at risk or dealing with cancer. It's nice to keep up with the new research so you'll know what to do. You do not have to be alone on this journey. You have people like my guest and I who will help and walk with you. So thank you so much for being here today. And also thank you, Doc, for being on the Protecting Your Nest podcast. I'll make sure to have a link to that video in the notes as well. And I hope this video added value and gave you hope. The only last caveat I'll add is whenever you're doing what may be considered non-traditional labs, make sure to talk to your lab to make sure you know if insurance will cover it or not. And if they're not covering that, you know what the cost will be out of pocket. So until we meet again, guys, continue to be safe, be well, and continue to protect your nest.